Hello my dear guardians, I hope you all are fine and having a very safe and sound health. Today we will talk a little bit about a starting kick of pharmacology for students who are new and find pharmacology very difficult. So first of all we will define pharmacology, then fields of division of pharmacology, then differences between pharmacology and toxicology. After this we will have division of some common drugs and their usual dose along with their types, so that you can easily remember drug types to identify and memorize its effects. So let's get started from definition of pharmacology. Pharmacology is a branch of medicine and pharmaceutical sciences which is concerned with drugs or medication actions. Now what is drug? A drug may be defined as an artificial, natural or endogenous molecule which exerts a biochemical or physiological effects on the cell, tissue, organ or an organism. If we come towards division of pharmacology, then pharmacology can also focus on specific systems comprising body divisions related to body systems, study the effects of drugs in different systems of the body. These include neuropharmacology in central and peripheral nervous system, immunopharmacology in immune system. Other divisions include cardiovascular, renal and endocrine pharmacology. Psychopharmacology is study of use of drugs that affect psyche, mind or behavior in treating mental disorders, for example in depression. Pharmacology is closely related to toxicology. Both pharmacology and toxicology are scientific disciplines that focus on understanding properties and action of chemicals. However, pharmacology emphasizes the therapeutic effects of chemicals, usually drugs or compounds that could become drugs, whereas toxicology is study of chemical adverse effects and risks assessments. Now if we talk about the basic drugs which are usually used in our daily routine, and we will categorize them according to their mode of action so that you can easily remember them. First of all we will talk about the CNS. So I have listed 16 drugs in this list named as sodium valproate, carbamazepine, phenytoin, phenobarbital, topiramate, levetiracetam, clonazepam, alprazolam, bromazepam, escitalopram, amitriptyline, sumatriptan, procyclidine, amantadine, flunarizine and carbidopa plus levodopa. Most of them are used in tablet form and their prescribed or usually dose is given in case you want to study for your extra knowledge. Now we talk about respiratory system, then we have 8 drugs and drug combinations. First of all we have salbutamol, which is used in combination with beclomethasone, which is strong inhaler. Beclomethasone can be used separately too like salbutamol. Next is ipratropium. Then we have salmeterol, which can combine with fluticasone. Next is montelukast and theophylline. So our respiratory drugs are salbutamol, salmeterol, beclomethasone, ipratropium, montelukast and theophylline. Their amount or dosage is also given for your extra knowledge. In CVS, we have 11 commonly used drugs which are named as nitroglycerin, isosorbide mononitrate, isosorbide dinitrate, aspirin, atorvastatin, simvastatin, rosuvastatin, clopidogrel, which can be used in combination with aspirin to amiodarone and digoxin. For GIT, we have 21 drugs because mostly and commonly drugs are used in GIT treatment. So they are aluminium hydroxide, loperamide, metocupramide, itopride, ranitidine, cimetidine, prochlorperazine, drotaverine, mibavirin, metopine, sucralfate, lactulose, domperidone, omeprazole, esomeprazole, pantoprazole, rapperazole, lansoprazole, sodium picosulfate, bisacodyl and dimenhydrinate. Antihypertensives are included in 4 categories, which are calcium channel blockers, beta blockers, third is diuretics, and fourth and last category of hypertensives is ACE inhibitors and ARBs. So first of all, calcium channel blockers have amlodipine, nifedipine, verapamil, and diltiazem. Second is beta blockers, which included atenolol, metoprolol, and propranolol. Third is diuretics, which includes 12 drugs which are named as hydrochlorothiazide, furosemide, spironolol acetone, which can be combined with furosemide too. Then insulin 70/30, insulin NPH, insulin glargine, thyroxine, carbimazole, propylthiouracil, prednisolone, and hydrocortisone. Fourth and last category of hypertensive is ACE inhibitors and ARBs, which are having 6 drugs, namely lisinopril, captopril, enalapril, losartan, valsartan, telmisartan, in which lisinopril and losartan can be used in combination with hydrochlorothiazine. For antibiotics, it's divided into 2 categories. First is oral category, having 13 drugs which are named as amoxicillin along with clavulanic acid, cifradine first generation, cefixime third generation, ciprofloxacin, levofloxacin, ofloxacin, clarithromycin, moxifloxacin, azithromycin, doxycycline, metronidazole, and clindamycin. While parenteral category of antibiotics include 13 drugs which are named as ampicillin plus cloxacillin, benzylpenicillin, coamoxiclav, clindamycin, ceftriaxone, cefotaxime, ceftazidime, amikacin, gentamicin, ciprofloxacin, levofloxacin, clarithromycin, and metronidazole. Now last category is analgesics, having 12 drugs which are named as aspirin, ibuprofen, flumiprophen, diclofenac sodium, naproxen, piroxicam, nimesulide, ketorolac, paracetamol, tramadol, tizanidine, thiocalcicoside, while paracetamol can be combination with caffeine or phenadrine or codeine. So we discussed total 7 categories of drugs along with subcategories. For revision, we discussed 16 drugs of CNS, 11 drugs of CVS, 8 drugs of respiratory system, 21 drugs of GIT, 25 drugs of antihypertensives in 4 portions, having 4 in calcium channel blockers, 3 in beta blockers, 12 in diuretics, and 6 in ACE inhibitors. Likewise, we studied 13 drugs in oral category of antibiotics and 13 drugs of parenteral category of antibiotics. Lastly, we studied 12 analgesic drugs. So this was all basic about pharmacology. So see you all in the next other topic. Till then, stay safe and keep smiling. Thank you.